So let me do the vertebral column and I'll give you guys a brief. All right. Okay, vertebral column. We have a few different sections of vertebrae. Cervical vertebrae in the neck. Thoracic vertebrae in the thoracic cavity area, or in that area. Lumbar over here. Then we got the sacral, or the sacrum, which is all fused, and then coccyx. We have 7 cervical vertebrae, 12 thoracic vertebrae, 5 lumbar. The sacrum in an adult there's 1, but in a child it was 5. It fused. The coccyx or tailbone, which we really don't use anymore, we have 1, but in a child or a fetus there was 4 that fused. Easy to memorize. You eat breakfast at 7 o'clock, lunch at 12 o'clock, dinner at 5 o'clock. Don't make it hard, okay? When you do the quest, or if you've done it, you can understand why I need you to know those terms. Okay? It's all going to come back. The way we number these vertebrae is simply C1 is the first one, C2 is the second one, and so forth. You had a fracture to T9. Then it's thoracic vertebra number 9. You can count them. Okay? That's how we label those. The spinal nerves, which we'll talk about later, come out underneath each one of those vertebrae. And those are also called, spinal nerve T9, spinal nerve T10, and so forth. So it's going to be similar there. Okay? So everything I just explained is right here. Now, let's talk about a general run-of-the-mill structure of a vertebrae. I'm not talking about a lumbar vertebra or a thoracic. Let's just look at a run-of-the-mill regular vertebrae and its parts, and then I'll show you the differences between these vertebrae. You're looking at the top of the vertebra. Okay? This is anterior by the belly. This is posterior towards the back. You'll have a body over here also known as the centrum. This is where an intervertebral disc sits on. One of these blue things. Okay? The intervertebral disc is made up of what cartilage? Fibrocartilage. Ooh, you learned something. See? You get to use it. Okay? So that sits on top of here. And also below there too. You also have a big hole here. So you're going to be guessing it must be a foramen. And what bone is this? A vertebra. So guess what this hole is called? Vertebral foramen. Hey! Alright? Pretty easy. Alright? Questions on that? Now, you also have this arch. This is called the vertebral arch. Now, I know it's labeling vertebral arch here and here, but you understand it's all around. You can't have half of an arch, and it's an arc. I guess, I don't know, half of a C. But it's the whole thing. I guess if you put if they labeled each one of those, there's too many circles. Okay? So this whole thing is the vertebral arch. We have things coming off of it. These are called the transverse processes, because they kind of go with the transverse plane. One towards the posterior aspect is the the spinous process. And when you run your finger down someone's back, you're running your finger on each one of those spinous processes. Yeah? Okay? Now, let's get back to the vertebral arch. The parts of it. The two parts that come off the centrum, which is this again, of the body, those two parts that connect the centrum to the transverse process, this area here and here, that's the pedicles. Then we have this area here that connects the transverse process and the spinous process. There's one here and there's one here. That's the lamina. The spinal cord goes through the vertebral foramen. If we have to have access to the spinal cord, surgeon needs to get there. I guess you can actually go from the belly, go through all that muscle to get back here, to go over here and go on the side here. That's not a good idea to go that way. It's too complicated. So instead, they just go right from the back. This is all muscle right here, back muscle. You just go straight here. You take this section out, and you have full access to the spinal cord. This procedure is called a laminectomy, because we're removing the lamina. Ectomy means removal of, lamina is that part. Yeah. That's what they did. Okay? You wouldn't do I don't even know what they would call it, a pedalectomy. But it wouldn't happen. It's too complicated to do it that way. But a laminectomy is just that. They remove that section. And then they put it back, and that's like a fracture. So they'll just let it heal by itself. It takes about 6 to 8 weeks to heal. You're all healed. Yeah. Okay. Okay? So does that make sense? At least a run-of-the-mill kind of vertebrae. Now let's talk about what makes a cervical versus a thoracic versus a lumbar vertebrae different from each other using these things. Here's a cervical vertebrae. Okay? Now the only thing is, this is going, here's anterior, there's posterior. These pictures are good, but they kind of put them upside down. No biggie, all right? So here's anterior and here's posterior. It's just upside down. Or right, maybe this is upside down. So this is a cervical vertebra. There is no transverse processes on a cervical vertebra. Instead, they have cervical foramen, however. It's the only one that has 3 holes. The transverse foramen allow the vertebral arteries that go through to go inside the skull to give your brain blood supply. What goes through the spinal, or the vertebral foramen? The spinal cord. Oh, let me go back. I forgot to tell you. A couple other things here. This is the superior view. We also have something we call superior articular facets, also known as superior articular processes. We have superior articular processes here, and there's also another superior articular process here. We have a superior articular facet. Guess what else we got? Inferior. You can't see it here because it's behind the screen. Those, I'm going to show you how they interact with each other. Because when the inferior articular facet from up here articulates here, that's how it happens. But we'll get into that. Okay? You'll see that on a side view is where it's best going to see. So let me get back to this. Again, cervical vertebra, there's the centrum of the body. This is the vertebral foramen. There's no transverse processes, but there is transverse foramen. And the vertebral arteries go through here. They go through the vertebral column, so we call them vertebral arteries. And they give blood supply to the brain. You have the spinous process here, and usually, not all the time, but usually it's bifid over here, or forked. This is a cervical vertebra. And you can see it looks very similar to that one up there. Here. All right. Okay. Which, by the way, I'll never ask you, is this C4, C6? You won't know that. The only ones you'll need to know is C1 and C2, but they're totally different. They're the exceptions, and you'll see that. You should be able to recognize this as cervical, thoracic, or lumbar. Okay? the thoracic vertebra. You can already see there's a difference between the two. There's cervical, there's thoracic. There's the centrum of the body. These do have transverse processes. No transverse frame in them. There's the vertebral frame. Here's the spinous process. The spinous process is usually long and slender, never bifid. And it looks like this. Long and slender. Okay? The lumbar vertebra. We only got 5 of these. They're the biggest of them all, but be careful because we do have pediatric vertebrae here and you couldn't tell by size. So learn it by features. It does have transverse processes and it does have a spinous process. Its spinous process is usually short and stubby, and you can see that. Okay? Now, I find that most students have issues with the thoracic and lumbar vertebra. So let me give you some pointers. What I have in my left hand is a lumbar vertebra. What I have in my right hand, I won't do it that way. What I have in my right hand is the thoracic vertebra. What I have in my left hand is a lumbar vertebra. You can see that the spinous process is long in the thoracic vertebra. And short and stubby in the lumbar vertebra. God bless you. Now, the other thing I'll show you is look at the body of the centrum of the vertebrae. What shape do you see the thoracic vertebra have? What shape does that look like? Well, I mean, just geometry kind of shape. Heart. It looks sort of like a heart, right? What about the lumbar vertebra? The body. What shape does that look like? The what? Triangle. But let's use heart, right? It looks, to me, it looks more like a heart. But this one, what does that look like? Kidney, right? So the lumbar vertebra is shaped like a kidney, at least the centrum, and the thoracic vertebra has a shape like a heart. The heart is located in what region? Thoracic. The kidney is located in what region? Lumbar. Okay, you could use that if you want. The other way that I came up with in medical school, and then someone published it, and I don't know the person, so I can't say I came up with it because someone else in another country or in another part of the world came up with it too. I just wasn't, I guess I was procrastinating, didn't publish it. I lost out on that, okay? But look, and just bear with me. The thoracic vertebra, when you look at the shape, it looks like an animal's head. See it? To me, it looks like a giraffe's head. You see it? You can see the ears going up. You see the antlers up here, the nasal over here. Do you see it? Does that make sense? When you take the lumbar vertebra, that also looks like a certain animal. What does that look like? Moose. That's what I use as moose. Hey, if this looks like a giraffe to you, or not a giraffe, but it looks like a rooster, go whatever pops into your head first? This is what popped into my head. And it looks, you know, if you look at the moose, it's got the snout over here, the antlers up here, those things that dangle down. And to me, that kind of looks like the moose. So you can see the giraffe, and let's put it together so you can see it. Okay. And actually, when you have this in your hand for practical examples, you can pick these up, put it in the position of making it look like the giraffe or the moose, because that's the way it sits in your body. So when you have to deal with superior and inferior articular facets, you know which is which. Does it go this way? Does it go that way? If you know it sits like the animal's head, you know that's how it sits in your body. Okay? Sound good? All right. So those are our three, and you can pick out those differences in there. Again, I won't ask you between L4 and L2. Just know it as a lumbar. Okay? Now, this also puts together those, like chart form, location, vertebral body, what it looks like of the cervical, thoracic, lumbar, and you can compare and contrast all three of those, okay, in the chart form. Now, we have two exceptional cervical vertebrae, though, that don't fit with all the rest of the cervical vertebrae. They look weird, and it's really C1 and C2, so the first two vertebrae going down. C1 is known as the atlas, and it looks weird. It doesn't have a spinous process. They call it Atlas, like if anyone here knows about mythology, Atlas is the god that's holding what? The world. So this is holding your head. Okay? I guess that's how they came up with it. I would have called it something else, like vertebra number 1. But, okay? But that's how they came up with it. So it looks like that. It's a kind of a weird thing. Okay? Now, the atlas is going to sit on, so the superior articular facets of the atlas are going to sit on the two occipital condyles that are on the occipital bone, that ride on either side of the foramen magnum, those two little knobby things. And when you take the C1 or atlas and articulate it with the skull, and it articulates, it's going to give you this motion. It'll give you flexion extension. It's going to make you nod your head yes. Okay? Okay? Does that make sense? So here's a mouthful for you, and I'll repeat it. The superior articular facet of the atlas will articulate with the occipital condyles of the occipital bone to give you the action of flexion and extension. Say that to your parents, and they're going to say, just continue going to Gemara because you must be learning something. Okay? So I'll repeat that. Let me go around and show you this. The superior articular facets of the atlas is going to articulate with the occipital condyles of the occipital bone to give you the action of flexion and extension of the neck. It's a mouthful, I realize. I'll never ask you to write that, but at least if you understand that, you'll understand at least the features of what we're talking about. Okay? But it's going to give you that flexion extension. Okay? Now, that's the atlas, or C1. But then we have C2 that looks kind of weird too. That's called the axis. Now we did something right, at least atlas and axis in alphabetical order. We're going down. That makes sense. But the axis looks different also. It has a little nubby thing up on top. We call that the dens, also known as the odontoid process. And it's shaped like that. It's a weird looking thing. But C1 and C2, the atlas and axis, also have, as with the other cervical vertebrae, they have the transverse foramen and the vertebral arteries go through them also. Now, here's where the articulation of this happens. The superior articular facets will articulate with the inferior, I'm sorry, let me repeat that. The superior articular facets of the axis is going to articulate with the inferior articular facets of the atlas. And when they do, it will give you a rotational kind of movement. Shaking your head, no. And you can see that. I'll go around. And I'll repeat it for you guys. The superior articular facets of the axis will articulate with the inferior articular facets of the atlas. And that's going to give you rotational action of the neck. Now, if I'm spending that much time talking about this, hint, 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 hint. Someplace on the practical exams, you're going to get a few questions on this kind of thing. All right? So it's doing that kind of motion. Okay? So it does this kind of, here's C2, here's C1. Right? Or C1, here's C1 is this, and C2 is here. It's axis. They call it axis because it's going, your axle is basically doing this. It's, if you got a rod that's going through your backbone, it's doing on the axle. So I guess they call it axis. Like I said, I have a bunch of other terms I'll be calling it that are much easier to remember than this other stuff. Okay? Now, sacrum really fast. Sacrum. Any questions? Good. All right, that's it. All right. The coccyx. You got a bone now, tailbone over here. A lot of the sacrums already have it broken, but that's coming down here. We'll talk about that a little bit more when we get to the pelvis. All right. All right. And these are foramen. Spinal nerves come out of it. We have the curvature. We have the cervical curvature that goes this way, the thoracic goes this way, lumbar goes this way. We want these curvatures there. If it was straight and you jump off the desk from there onto the floor, boom, you'll be breaking all your bones. This allows us, and I'm going to exaggerate, this allows our body to have the springing motion, that kind of thing. So we have a cushioning, so we could jump, it'll give it a little bit of a, this S kind of shape gives it more of a cushiony jump to us. So you're not going to have it just bone to bone, just crumble. But we could have exaggerations of these curvatures also. We could have a lateral curvature, and that's called scoliosis. A good example that would be causing this is that one leg is shorter than the other. So it's going to do this kind of motion, right? Or action. Not action, but position. If we have an exaggeration of the thoracic curvature, then we call that kyphosis. That's hunchback. Okay, and we see that in some older people, right? If we have an exaggeration of the lumbar curvature, they'll be walking like this. And we see that too. That's called lordosis. So kyphosis is the hunchback, lordosis is this way. I just remember thinking lordosis like saying, oh Lord, this is what it really looks like here. Okay? Now, let me show you the side view of this, because I want you to see what's going on. Here's one vertebra. Okay? But there's one hole we didn't talk about, one foramen. But you can't see it when you only have one vertebra. You've got to put two together. We have, here's one vertebra, and here's the other one. Now look what's happening here. This here is the superior articular facet of this vertebra. See it? And it articulates with the inferior articular facet of the one above it. You see how they articulate with each other? Can you see it there? Sorry, Fred. All right. See it? When you do this, you create a new hole, a new foramen. This is called the intervertebral foramen. And that's going to allow spinal nerves to come out of it. You can only appreciate it when you put two bones together, two vertebrae together. You also can see the intervertebral discs in between the vertebrae. If you had a motor vehicle accident, a fall down, some kind of trauma, this could kind of crush that disc and make the disc bulge out that way, a herniation. And it could press right against the spinal nerve that's coming out of here. Looking at the top view, here's an intervertebral disc. There's the vertebral foramen with the spinal cord. We kind of showed you before where you can see the butterfly in there. Here's a spinal nerve coming on either side. If this intervertebral disc gets traumatized and bulges that way, it can press against that nerve and cause pain or numbness or whatever it's doing in there. We'll talk about what's going on in the spinal nerves later. That's what a herniated disc is. Sometimes it's traumatized and it's inflamed, and it takes days for it to actually go back to its normal, it's not inflamed anymore. It goes back to its normal size. So that's why sometimes it can go away. Okay? Let me just do this. Take me 2 minutes to do it, and I'll give you that break. The rib cage. Pretty easy. There's 12 ribs over here. This is the sternum. There's 3 parts of the sternum you need to know. The chest plate, but it's called the sternum. We have the manubrium, which is up on top, the main body of the sternum, and then we have a part over here called the xiphoid process. The xiphoid process is the most commonly fractured part of a bone that gets fractured during CPR. You could feel that xiphoid process over here, and when you do CPR the proper way, you go 2 finger breadths below that, and that's where you put your hand and you start doing that. It still gets fractured though because it's too close. Who cares? All right. Xiphoid process begins with an X. If you know how to do CPR, you got A, B, C: airway, breathing, circulation. Xiphoid is way down below. Who cares about that? All right, that'll all heal by itself. Okay, but the xiphoid process, most commonly fractured bone while doing CPR. It happens. Don't worry, you're not going to get sued. You get a good Samaritan law covers you for that. All right, I mean, don't punch him. Okay. Now ribs, very quick. We have all the ribs. All 12 pairs attached posteriorly to the thoracic vertebrae. All of them. Anteriorly, they don't. The first 7 ribs do attach to the sternum, and we call them the true ribs. There's some cartilage in there, but yes, they still attach to the sternum. Ribs 1 through 7 are pairs. Okay? Ribs 8 through 12 don't attach to the sternum directly. These are called the false ribs. And specifically, ribs 8, 9, and 10 all have to attach to rib 7, and then that gets attached to the sternum. So indirectly, they attach to the sternum, but they first have to attach to rib 7. Ribs 11 and 12 don't attach to anything anteriorly anyway. We call them the floating ribs, which are still part of the false ribs. Okay? So again, true ribs are ribs 1 through 7. False ribs are 8 through 12, which specifically ribs 11 and 12 are also known as the floating ribs. And you can see them on Fred over here, the two floating ribs, 1 and 2. Okay?